Irish pop star Sinéad O'Connor, who became well known for both her music and her personal struggles and her fearlessness, right? She has died, according to Irish media. She was 56. A statement from her family reads, "It is with great sadness that we announce the passing of our beloved Sinéad. Her family and friends are devastated and have requested privacy at this very difficult time. No cause of death immediately available. London police said moments ago they're not treating the death as suspicious." Joining us now, clinical psychologist Dr. Rebecca Berry and contributing editor at Rolling Stone, Anthony DeCurtis. Good morning to you both. Appreciate it. Let's begin with you, Anthony, and just remember the life, the voice, the fearlessness, that moment on SNL that no one will ever forget.
Of course.
With the photo of the Pope.
Well, you know, I mean, Sinéad was just an incredible kind of cataclysmic talent. You know, from her first record, which actually I reviewed in Rolling Stone, I mean, I sort of announced her as somebody that was going to be extremely important. You know, I didn't really understand the ways in which she would ultimately be important, you know, but, you know, there was a kind of fearlessness about her that you've mentioned, a willingness to kind of defy any kind of expectation. And, you know, that worked extremely well, and I think it's had a huge impact, particularly on younger female artists who look up to her. You know, certainly from a commercial standpoint, it, you know, essentially destroyed her career. But, you know, those are the kind of complexities, I think, that Sinéad was dealing with her entire life.
In terms of those complexities, Doctor, she had talked a lot and wrote about what she struggled with. She talked about abuse as a child. She talked about that lingering trauma for her and how it influenced her life. Speaking out about it so publicly, that had its own power.
Mm-hmm. She, in many ways, was an advocate for mental health issues, and certainly, I believe, was attempting to break down the stigmatization around mental health by being so public about her own struggles.
We talked about last hour with our correspondent, Chloe Melas, that she had a child who she had lost last year at the age of 17. This also comes in a moment when so many more people, thank goodness, are speaking out about their mental health issues and the power of that coming from someone like her.
Right. I think that in seeing Sinéad be so vocal about her struggles and her history of childhood trauma, really abuse, you know, the hope is that it can really open the door to other individuals, including youth, to also seek help and support for what they're going through and really learn ways to manage some of the difficult pain and distress that they may be having.
Yeah.
You were talking about what she contributed, right? It was tough to know with that first review what she would ultimately become, who she would become, what she would mean to so many people. But I know you've also noted that some of those struggles, some of her very public struggles, in some ways also hindered her efforts to really be an advocate.
Yeah, absolutely. I think that there was a kind of a way in which her, I think, emotional and psychological difficulties became somehow really intertwined with her kind of social and political views. And it became just easy for people to dismiss her, you know, and I think that was sad. I mean, because, I mean, I think that now certainly we could see, you know, all of the things that she talked about with child abuse, certainly, I mean, it's a much bigger issue now. People are much more aware of it. And, you know, there are elements of that, but, you know, when she tore up the picture of the Pope on Saturday Night Live, that's all that people talked about, you know, and that was, I mean, that was a big problem for her. Now, you could say, well, that's what you do if you're a punk or you're a radical or you're whatever, you just kind of upset the apple cart. But if you think about, you know, your protests as hoping to bring people over to your side, I mean, I don't think Sinéad really managed to do that.
I was wondering if some of that may have softened, though, in later years as more people were speaking out about some of their struggles and maybe how that played in. And it'd be interesting to see.
An action like that today would be perceived very differently.
Yeah, that's the time.
Without a doubt.
It wasn't the time to receive that. It wasn't the way for her to get the support. But certainly, as we know about the conditions from which she did suffer, there was a lot of complex things happening for her and the distress that she was feeling.
Yeah. Doctor, thank you very much, Anthony. Thank you.
Well, thank you.